Mr. Speaker, I ask question 009 of 2024, the Cabinet Secretary for Health. Could the Cabinet Secretary explain why the ministry is yet to post medical interns who ought to have been posted in September 2023, noting that such a delay denies the affected graduates the opportunity to put into practice the theoretical skills gained? Question number 2, provide timelines to which the collective bargaining agreement signed in 2017 between the Kenya Medical Practitioners, Pharmacists and Dentists Union and the government will be fully implemented. And number 3, outline the steps being taken to resolve the recent disputes and end the strike to ensure uninterrupted health delivery. Thank you, Mr. Speaker.
Proceed.
Thank you, Honorable Speakers, Honorable Speaker and Honorable Members. It's always a pleasure for me to appear before this House to speak to the people's representatives and to explain what the ministry is doing. On the question raised by Honorable Timothy Wanyonyi, that the ministry explains why the ministry is yet to post medical interns who ought to have been posted in September 2023, noting that such a delay denies the affected graduates the opportunity to put into practice theoretical skills gained. Honorable Speaker and Honorable Members, the ministry had a total of 3,759 interns as at February 2024 for posting under the different cadres as indicated. We had 849 medical officer interns, 72 dentist interns, 289 pharmacist interns, 1,134 nursing degree interns, 145 degree clinical officer interns, and 1,270 clinical diploma interns. Of these that I have mentioned, 1,270 clinical officer diploma interns were posted and they have already reported in their placement centers. Another 1,210 medical officers, dental officers, and pharmacists have been posted, and their letters of posting have equally been shared on their emails, and they are expected to have reported starting the 15th of April, and the ministry has started taking stock from the internship centers to determine how many have so far reported. The ministry is now in the process of finalizing the process for posting the nursing 2,404 nursing and clinical degree interns, and they will start collecting their letters, and we have equally posted on their emails. They also ought to report starting the 15th of April, which has already passed. Honorable Speaker and honorable members, I would like to note that, however, there was a delay in the posting of interns due to lack of budgetary allocations. In the financial year 2023-2024, the ministry was allocated a total of 3.6 billion to cater for internship program against a requirement of 5.7 billion. This resulted in a gap of 2 billion. This gap was considered during the supplementary estimate number 1 and was able to cater only for the 4,156 interns who were posted in July 2023. The ministry appealed to the National Treasury to provide funding of 4.8 billion to cater for the placement of the 3,759 interns through a letter dated 1st of February 2024. The National Treasury replied to the letter through a letter on the 13th of February, indicating that they were not in a position to provide requested funds and advised the ministry to rationalize the numbers and equally to review the internship policy with a view to accommodate more interns within the available budgetary provisions. Following the guidance from the National Treasury, the ministry wrote to the Salary and Remuneration Commission for guidance on how to rationalize that. The SRC responded by providing stipend rates to be payable to interns. With the rates from the SRC, the ministry wrote to the National Treasury and managed to secure 2.3 billion to post the 3,755 interns. It is on this rate that the interns I've indicated above have been posted. Honorable Speaker and honorable members, on the second part of the question, that the ministry provides timelines to which the collective bargaining agreement signed in 2017 between Kenya Medical Practitioner, Pharmacy and Dentist Union and the government will be fully implemented. Honorable Speaker and members, the collective bargaining agreement signed with KMPDU in 2017 continued to be implemented by the national government. The national government has so far undertaken the following to fulfill its obligations under the CBA. 1, it has facilitated the payment of basic salary arrears accrued by the national government entities arising from the 2017-2021 CBA. And I would like to confirm that indeed the national government has actually even paid in excess, and there are some doctors who owe the national government some money. The national government has also provided grants and scholarship for eligible postgraduate medical officers based on immediate service needs basis. Equally, the national government has provided comprehensive medical insurance to the doctors at the national government level. In the financial year 2023-2024, the ministry posted 4,156 medical interns in July 2023 at a total cost of 4.3 billion. These interns are due to complete their internship in June 2024. Similarly, the ministry secured 2.3 billion to post the 3,759 medical interns according to the SRC advisory rates. However, there are challenges in implementation of some of the provisions, including the areas of internship. These challenges will be addressed in the new cycle of negotiations of the CBA, which is ongoing. It is also important to note that a good number of those aspects of the CBA need to be implemented by the county governments. The third question, Honorable Speaker and members, outlined the steps being taken to resolve the recent dispute and end the strike to ensure uninterrupted healthcare delivery. Honorable Speaker and honorable members, the ministry is taking various steps and measures to resolve the ongoing strike. The measures being taken have been categorized into immediate and short-term, medium-term, and long-term. In the short-term and in the immediate, the ministry has posted all interns, and this posting was from 2nd of April based on the revised rates of SRC. All the interns ought to have reported to their internship center by the 15th of April. Honorable Speaker and honorable members, I've said the ministry is in the process of collecting returns from the respective internship centers. In a few days, we shall be able to report on how many of these interns have actually reported. But we confirm in the affirmative that the clinical officer diploma interns have reported, and we have returns at the ministry. The ministry has also requested for 267 million for payment of postgraduate registrars' fees arrears. I stand to confirm, Honorable Speaker and members, that in this week, the ministry has received a confirmation from National Treasury of 200 million that will be given to the ministry to be able to pay these arrears. The ministry has also requested SRC to advise on the demand by the Kenya Union of Clinical Officers to have their risk allowance increased from 3,000 shillings to 15,000 shillings. Honorable Speaker and honorable members, this is a 500% increase. So the ministry awaits for guidance from SRC, and based on the guidance that we receive, we shall be bringing this into the budget so that then once approved, we should be able to effect it. The ministry has also requested the Public Service Commission to review the clinical officers' career progression guidelines. The medical laboratory officers who have joined the doctor strike do not have a recognition agreement with the government. Therefore, the ministry has written to them citing the criteria that is required for them to be recognized as a union, and we wait for them to return back, having met the criteria, and then we start the process of recognition. Those are under the immediate and short-term measures. Honorable Speaker and honorable members, under the medium-term measures, the Ministry of Health is reviewing the internship policy to address aspects of the program, including the need for students to transit to internship without any delay. The internship policy will be finalized within this month of April. Happy to report, Honorable Speaker and members, that yesterday the ministry undertook internal stakeholder validation, and it went very well. And next week we shall be proceeding to external stakeholder validation to receive the comments of the external stakeholders. Honorable Speaker and members, the ministry is ongoing with the CBA negotiation. The 2017 CBA lapsed in 2021, and therefore we are in the process of negotiating on the new CBA to be signed. The ministry is also actively participating in the whole of nation approach discussion that were ordered by the judge of the Employment and Labor Relations Court. In the long-term measures, Honorable Speaker and members, the ministry is in the process of developing a comprehensive human resource for health policy to address all aspects of human resource in the country, in the entire spectrum of the value chain, from production, supply, internship and regulation of employment, retention of the health workers, distribution and stock density, skills and mix, including motivation and productivity of the human resource for health. The ministry also in the long term would want to operationalize the Kenya Health Human Resource Advisory Council to enable it to execute its mandate. This entails providing the necessary budget finalization of the human resource instruments in order to obtain the necessary skills and capacities to execute their mandates. Other measures that are being taken by the ministry is that the Cabinet Secretary, Minister of Labor and Social Protection, was appointed by the court and has appointed 3 conciliators to guide the parties to arrive at the dispute, and the process is ongoing. To arrive at a resolution, and the process is ongoing. The court also appointed the whole of nation approach that is being led by the head of public service to bring together both levels of government and entities to the dispute with a view to seeking a solution to perennial issues in the health sector, and the process is ongoing. Honorable Speaker and honorable members, I hereby submit. Thank you.
Yes, member for Westlands.
Thank you, Honorable Speaker, and thank you very much, Waziri, for that elaborate answer to my question. However, I would like to seek clarification on a few issues. Considering the importance of maintaining stable healthcare system, what strategies are being implemented to prevent similar delays in disputes in the future, particularly regarding the implementation of agreements and timely placement of medical professionals? And the second clarification I need is, what strategies are in place to regulate the number of graduates from the medical schools in the country, and efforts for coordination that will ensure Ministry of Health is aware of expected interns before every budgeting cycle for adequate planning? Thank you.
Minister, you'll take several, having gotten from the questioner. I'll allow a couple of joyriders, starting with the member for Seme.
Thank you, Mr. Speaker. I would have liked to do more than being a joyrider, but this, as we know, the whole week I've been trying that, but I'll take what is available. Mr. Speaker, the issue is that the interns have been posted. And that's what we are told. But what we know, not all interns have reported. And then that brings to me the issue that I would like a clarification from the minister. When we use the word intern, who are we talking about? There are various cadres within the ministry, and they do different internship. Now, there are also generally in the country the term internship which is used in industry. Do we have a clear clarification of who these are? And why I ask that question, Mr. Speaker, is this. We have some interns who are now employed. Now we have interns who are now going to get stipends. If we understand it, the difference between somebody who is earning a salary and somebody who is given a stipend is that the person who is being given a stipend is not employed, but is being given some support. By definition, an intern is actually a doctor who is starting work. He or she has graduated, has taken the Hippocratic Oath, has actually been given an interim license. And when they are on duty in hostels where they are, the structure in those hostels will normally be, amongst the doctors, there's a first on call, who is always the intern, there's a second on call, and there's a third on call. And at all these levels, people call on the next level if they reach their limit of ability. And many, many times, in many situations, interns will actually see patients right through to discharge and they go home. So when we are now talking of stipend, are we saying these people are not employed? So you will then have two, one on a full salary of what we are talking of 200,000 and one on the salary of 90,000, working side by side doing the same thing. How will that work? And is that good for peace in the industry?
Because of your tremendous interest on the matter, can you now ask the question? You've been making a speech.
Mr. Speaker, all these are questions. When we talk of insurance, the minister said the insurance has been paid at national level. What that means is there are some doctors at county level that do not have an insurance. And that actually is the status. Why is it not that we use the coordination mechanisms within the government provided in the Constitution so that health workers, not just doctors, have similar conditions of work across? Because that is provided for, and that is one of the reasons that is giving us problems. Mr. Speaker, the next one is the postgraduate doctor. And why I'm asking this question, this is a problem that has been there. It is in the strike now. I've said in our committee, and we have put this, and I want to ask the minister if this can help this country. Why is it that when they come for postgraduate, they are working in hostels that are government hostels, which are funded by government, and the work they are doing is full work? Why can't we, while funding those hostels, create these positions which are paid for at that hostels so that the counties don't have to pay them when they are actually working in Kenyatta? The counties can then use that money to employ doctors during that period they are away, because that is giving us a problem.
Last one.
The issue of Well, Mr. Speaker, I'll stop, but it means that I may still come on with my request of yesterday because something I've not.
A whole 5 minutes to ask a question.
Now, recognition as members of the union goes back. Are we taking them as employees? Because if they are employees, then I think by rights they will have. So are they employees or are they not? I must add, Mr. Speaker, all over the world, medical interns are employees and they actually earn salaries. Even here in Kenya, there are private hospitals that are actually employing interns, paying them. So the question is important. Mr. Speaker, I have the interest of this country at heart, and therefore I know that is the last. But I want to make a suggestion which I think can help this country. This is not a question, it's a comment, and the minister can make a comment on it. The problem we are having is that we are saying that all interns can only be employed or must only be employed by the government, by the ministry. And we're limiting it. Why don't we put, and the minister will understand this, or her technical people, a regulation that all levels at which interns can work, and those are level 4 and 5, whether they are private or they are public, they create levels of position for interns by law. Because even when you start a hostel, there's a certain number of staff you should have. If we do that, Mr. Speaker, we'll open a large space for interns, and we shall not have this problem, and they do not have to be paid by the government. Today, Aga Khan as interns, they are paying. Karen as interns, they are paying. Tenwek as interns, they are paying. Kijabe as interns, they are paying. So we have to look at it broadly so that we actually can get rid of this problem that looks perennial of interns. Mr. Speaker, I may later on seek how to discuss this more, but for now, I'll leave it there.
Honorable members, I gave Honorable Nyikal that latitude because you know he had attempted to bring a motion of adjournment on this matter, and I assured him that I'll give him the latitude that I've extended to him. The rest of the joyriders, one question each. Mishimbogo.
Thank you, Honorable Speaker. Honorable Speaker, I just want to put a question to our CS, and the question is about what is the gross salary and the net salary for the intern? Is it true that it was reduced by 91%? Thank you, Honorable Speaker.
We'll take more Waziri, Junaid Mohammed.
Thank you, Mr. Speaker. Mr. Speaker, I would like to ask a supplementary question. First, I don't understand which law this whole government nation is anchored on. This concept of whole of government approach, I don't know what it is. I know Ministry of Labor, Ministry of Health, that's beside the point. But the interns' salaries or stipend, whatever you want to call it, in the CBA was meant to be 206,000. That's what they are claiming. The ministry initially proposed 47,000, but later went to 70,000. I would like to know from the ministry, how did you come up with that figure of 70,000? What did you consider in coming up with those figures? Is it the cost of living? Is it the availability of funds? How did you come up that 70,000 is enough for interns? I would like to know.
Thank you. Yes, I'll give to Mama Zamzam.
Asante sana Mheshimiwa Spika.
Swali moja tu.
Namuuliza waziri, nilimsikia akisema kuwa amewapa madaktari mambo yao kutatuliwa mpaka Julai. Nataka nimuulize, kuna yule mama ambaye ni mjamzito na mtoto amefika wakati wake wa kuzaliwa, anahitaji daktari kumsaidia. Huyu mtoto yeye amempangia kitu gani na kwa nini ameondoa Linda Mama ambayo yasaidia kina mama. Asante.
Mwenje, Minister, record all those. I'll give you.
Thank you, Honorable Speaker. Honorable Speaker, during this time where the doctors and the interns are on strike, I'd like the Cabinet Secretary to tell Kenyans directly, especially women who are expectant, where can they obtain services? This is an issue, Honorable Speaker. All members of Parliament are being contacted by their constituents, and because of the shortage of doctors, what options do Kenyans have during this difficult time? Thank you, Honorable Speaker.
Thank you. John Badi.
Thank you, Mr. Speaker. And I want to thank the Cabinet Secretary for a detailed answer or response to this question. But I just want to ask one straight question. The CS has indicated clearly that she has been asked by the Treasury to rationalize the budget of the ministry. What is the CS doing in that exercise of rationalization of the budget? Because a lot of money is spent on services which ordinarily should be devolved. Yet, important assignments for the national government, like this case of intern doctors, is given lip service. So what are you doing? Can you state to this House and to the people of Kenya specifically what you are doing in terms of rationalizing the budget of the ministry? Thank you, Mr. Speaker.
The member next to Mishi, you are very far, I can't. That is
Ken Chonga.
Ben Chonga.
Yes.
Yes, Mheshimiwa.
Thank you, Mr. Speaker. I would like to know from Madam Waziri. She said that the CBA of 2017 expired and they're working on the current CBA. But what measure is the ministry taking to avert any more strikes? Because it is like before the doctors are given whatever they have agreed in the CBA, a strike might follow. And so many people are suffering, people are dying. There is total chaos when in the history of the health industry. What measures is the ministry taking to ensure that we no longer undergo a similar situation again? Thank you.
TJ Kajwang. After that, Waziri, you can answer.
Thank you, Mr.
We'll
Speaker.
do another round.
Mr. Speaker, you know, you and I, we have the misfortune of, we can only be patients, not like my brother here who can be a doctor. We can only be patients. But I pray that you and I, we do not go to hospital around this time when things are still not very stable. Mr. Speaker, my question is two. One, Madam Minister, are you lying to this House?
That is unparliamentary language. Withdraw.
Are you misleading this House? I withdraw. Are you misleading this House? Because the reason you came to this House, according to the question that was asked, was majorly to show us the level of implementation of the CBA. You have explained that you have implemented the CBA. In fact, you said that you have overpaid according to the CBA. But the truth, or what we have, the information we have from our constituents is different.
She said a few doctors have been overpaid.
Yes, a few doctors
a general term.
have been overpaid.
Yes.
So the question about the implementation of the CBA, because if then the CBA is fully implemented, why would be doctors out there be continuing to be on strike, claiming that their monies have been withheld or have not been paid or have been underpaid by the ministry? So Madam Minister, are you misleading the House? Now, that is question one. Number two.
Only one.
No, Mr. Speaker, if you will just allow me, it's a very straightforward question. Very straightforward. Why are you not working on the return to work formula? Why are you insisting that you do not want to relate with the people that you have employed and discuss a return to work formula, that these people must go back to work first before they discuss with you a return to work formula, which they have shown you and which is reasonable and which has provisions on how both the employer and the employee must meet in terms of working on a return to work formula. Thank you, Mr. Speaker.
Thank you. Minister, you can answer those. Kibagende will come back to you. There will be another round. Those are 9 questions. You can, they're short questions, answer them.
Thank you, Honorable Speaker and Honorable Members. The first question on what is the strategy to ensure that this does not occur. Honorable Speaker and Honorable Members, in my earlier response, I did indicate that we do have immediate and short-term measures, we have medium-term measures, and we have long-term measures. The medium and long-term measures, Honorable Speaker and members, are to ensure that this does not occur. And this includes development of policies. The internship policy, Honorable Speaker, I have already said that our plan is to finalize by end of April. We have already done internal stakeholder validation. Next week, we shall be going to external stakeholder validation. And by the end of April, this policy shall be taken to Cabinet for consideration. And after that, it shall be brought to this House. Honorable Speaker and members, those are some of the strategies that we have put in place to ensure that this does not recur. Strategies to ensure coordination between the Ministry of Education and Ministry of Health. During this crisis period, Honorable Speaker and members, we have met together with my colleague, the Cabinet Secretary for Education, and we have put together a joint committee that includes the Commissioner of University Education, the Kenya Medical Practitioner and Dentist Council, COOPS, that is the one that admits students, the universities. And we have given them a timeline of 1 month to be able to look through what is it that is required in terms of production, in terms of the available facilities for training, and what we need to do to ensure that then we are training enough numbers that we are able to cater for. Honorable Speaker and honorable members, many years ago, it was only one university that was training medical officers, medical doctors in this country. As we speak now, we have 8 universities, 5 of them public and 3 private. All these, Honorable Speaker and honorable members, we have put them in the joint committee so that then we can find a solution that all the interns who come out of these universities, then we are able to absorb them for internship. From Honorable Nyikal, Honorable Speaker and honorable members, Honorable Nyikal is a member of the Health Committee, and on many occasions, I do refer to him on these matters. The issues that he has raised regarding the cadres that need internship. As a ministry, we have a total of 32 cadres, different cadres, all of them seeking recognition, all of them seeking to be paid for internship. But however, from this, only the medical officers, the pharmacists, the dentists, the degree nursing, degree clinical officer, and diploma clinical officers are the ones so far who enjoy stipends. So as the ministry works on the policy that we are working on, we will largely benefit from the wisdom of Honorable Nyikal on what we need to do in terms of recognizing the other cadres and also enhancing the cadres that are already getting the stipend. Medical insurance by national government recognizes all workers, all medical officers who work for national government. Honorable Speaker and honorable members, as we stand here, we very well know that those medical doctors who work for the national government, they work either at the ministry headquarters or they work in one of the referral facilities, the 6 referral facilities that we have. And those are the ones that I am confidently saying that the national government, through the Ministry of Health, has provided them with medical insurance. Honorable Speaker and honorable members, I am not in a position to confirm whether counties have indeed given medical insurance to their medical officers. That can only be confirmed by themselves, but from this crisis that has been going, a number of them, 36 of them, have confirmed to have medical insurance, and those who do not have, they have been asked to ensure that they have medical insurance. Regarding the registrars, we are working on a policy, Honorable Speaker and members, a policy to ensure that there's direction from Ministry of Health, because even as we train registrars, we must train those skills that are required for the national, those skills that are required by the country. We do not want to train excess of one skill and leave out another. So that policy is under development. Payment of interns. Honorable Speaker and honorable members, we were directed and guided by SRC, which is the body that is constituted by the Constitution to be able to guide. And from the guideline, they said it cannot be a remuneration, it can only be a stipend. And that is how we have recognized it. Honorable Speaker and honorable members, from the question from Honorable Mishimboko, what is the gross salary of an intern and what is the net thereof and what has been offered? Initially, an intern was earning 206,000. This includes basic salary and other allowances. That comes to a net of 135,000. Honorable Speaker and honorable members, based on the advice from the SRC, it is now a stipend of 70,000 shillings. And Honorable Speaker and members, I would like to clarify that none of the interns who is in session has gotten a reduction. Of the interns in session that will be finishing or concluding their internship in June 2024, there is no reduction. It is the new interns who we are now posting that are going to get in under the terms of the stipend. From Honorable Junet, the issue of whole of nation approach. This was ordered by the Honorable Judge of the Employment and Labor Relations Court. That order is what brought us together. And the judge did guide on the membership of the whole of nation approach. And in respect and in compliance with the court order, that group under the whole of nation approach has been meeting to find solutions to this crisis headed by Head of Public Service. Honorable Speaker and members, Honorable Junet wanted to know how 70 was arrived at. This was a guideline by the SRC. They would be the best then to explain how 70,000 was arrived at as a stipend. But need to say that they did look at the other interns within the nation, and actually they did inform us that the other interns are getting 25,000, and therefore they considered this higher and gave them 70,000. From Honorable Zamzam on Linda Mama, Honorable Speaker and honorable members, I would like to request, because there is a specific question on Linda Mama, I would like to request that I respond to it, because it's a substantive question that I'll be responding to later. Honorable Speaker, from Honorable Mwenje, he asked about expectant mothers and where do they go at this time of a crisis. Honorable Speaker and honorable members, I would like to appreciate Honorable Mwenje that despite him being a man, he is caring for the women. And for me as a woman, this is personal to me. As we speak now, Honorable Speaker and honorable members, we have levels of service in the Ministry of Health. We have level 2, which are dispensaries. Closest to the people within the villages, services are ongoing. We have level 3, which are health centers, Honorable Speaker and honorable members. Services are ongoing in those places. Where we are affected most by this crisis is level 4, level 5, and level 6, which are referral hospitals. But we have put measures in place to ensure that emergency services are being attended to. Last week when I did a tour of Kenyatta National Hospital, the maternity was full. Actually, all the expectant women around Nairobi are now in Kenyatta National Hospital being attended there. So we really have to see that the ministry has put in some effort. And I also want to thank Honorable Speaker and Honorable members that despite this crisis, we have very patriotic doctors who are working. We have been able to fill some of the gaps with those doctors who have been able to continue providing services, and I want to thank them tremendously for continuing to provide services to Kenyans. What have we done on rationalization? Honorable Speaker and Honorable members, after the SRC guidelines.
Junet, what's your point of order?
Mr. Speaker, I don't know whether you listened keenly to the Honorable Minister. The Honorable Minister, Mr. Speaker, has put up a very rosy picture that hospitals are working, Kenyatta Hospital is full, doctors are working, level 4, level 2, level 2. Mr. Speaker, that is not the situation on the ground, Madam Minister. People, there are no hospitals that are working. There are no wards that are full, Madam Minister. We are the people who are from the ground. Just say you are working on how to rectify the matter, but as of now, even the maternity that is full in Kenyatta Hospital, mothers are delivering on their own, or maybe with the help of few nurses.
Go on, Minister.
Thank you very much, Honorable Speaker and Honorable members. Level 2 dispensaries are manned by nurses. We have over 9,000 dispensaries in the country, and they are functional. Level 3 facilities are manned by nurses and clinical officers, and most of them are functional. I did acknowledge that indeed we have a problem at level 4, level 5, and level 6. But I say emergency services are being offered. And I just gave an experience of my walkthrough of Kenyatta National Hospital last week. Honorable Speaker and honorable members, on what the ministry has done in rationalizing, after we received the guidelines from the SRC, we, the ministry, met with the National Treasury on 2 occasions. And that is how we got to get 2.3 billion to be able to post the current interns. We have also been getting the numbers that are in the pipeline in the training institutions, so that then we plan ahead through the budgeting process to ensure that then they are taken care of. The other question, Honorable Speaker and members, is what is the ministry doing to ensure that this does not recur? And I would like to reiterate, Mr. Honorable Speaker, that through the medium-term, long-term position that I had raised earlier, we believe that the ministry will be able to resolve this, and this does not recur. However, Honorable Speaker and honorable members, I would like to thank members of this House that the ministry brought to this House 4 acts, and they were able to be processed. One of the outcomes of those 4 acts is the Social Health Insurance Act. The Social Health Insurance Act, Honorable Speaker and honorable members, as we sit here today, less than 20% of Kenyans have some form of medical insurance. So what we intend to achieve with the Social Health Insurance Act is to drive those numbers up and ensure as many as possible. Our target is to get at least 80% of Kenyans to be on insurance. And once resources are raised through the Social Health Insurance Act, we want to believe that we'll be able to take care of commodities, take care of equipment, and take care of the most important pillar of universal health coverage, which is the human resource for health. Honorable Speaker, the question from Honorable Kajwang about the CBA. Honorable Speaker and honorable members, we cannot live in denial. We have 2 levels of government, the national government and the county governments. A collective bargaining agreement is a document signed between an employer and an employee. The ones that I spoke about, the CBA progress that has been made by the national government, is for those employees who are for national government. And therefore, I can authoritatively say that as the national government, we have managed to implement some of the things asked for in the CBA. Therefore, the relationship between the employer, who is county government, and the doctors then should be managed as such between the county governments and the employees. The issue of return to work formula. Honorable Speaker and honorable members, this matter went to the court, and the honorable judge ordered that the doctors should suspend their strike and give negotiation a chance. And they did order that then discussions should continue under the whole of nation approach to this matter. And I want to believe once discussions are finalized, The doctors have suspended the strike, then a return to work formula will be arrived at. Thank you, Honorable Speaker and members.
Kibagendi. Honorable Nyikal, you're out of order. I've not given you an opportunity.
Thank you.
I will come to you.
Thank you, Honorable Speaker.
I hardly give members to have a second bite, especially when you're a joyrider. Yes, Kibagendi?
Thank you, Honorable Speaker. And my question to Honorable CS is why is NHIF not paying hospitals, both private and public hospitals, to the extent that our citizens are not able to get services? And in particular, there is discrimination to the region that I come from, Kisii County. Thank you.
Elisha?
Mr. Speaker, I just listened to the CS on our last statement, and I've just read in online that the AG has given an advisory that the teams will meet again so that this issue that is affecting doctors and the ministry can be solved expeditiously. So I think that's a good step on the right direction from the AG. I just wanted to give that information. Thank you.
Pasaris?
Thank you, Mr. Speaker.
You have your own question?
Yes, I do.
Oh, then if you are not on this, I saw your name here, then hold, I'll come back to you. Dr. Nyikal, I'll go out of my way to give you a second bite.
Chair, there was a question of coordination.
And there's no chair here, it's only the speaker.
Sorry. Mr. Speaker,
yes.
It's a question of coordination. The Honorable the Minister is right that they have paid at the national level and the county government have not paid. But my concern is the ministry holds policy, and this policy is actually supposed to be implemented across so that there should be uniformity on what is happening. And if it's not there, still there should be information at the level. And I was asking, are we using the constitutional bodies such as the Intergovernmental Relations Technical Committee, particularly the Health Forum, where the technical people at the ministry and at the county will meet? And so things will be done similarly at the national level and the county level. That is my question. Is it being used? Is it useful?
Thank you. Nisula?
Mr. Speaker, I wanted to direct my question to the Cabinet Secretary. I am aware that the National Insurance Fund, the National Health Insurance Fund, NHIF, ended the Edu Afia, where our learners were being covered, and I just wanted to find out what is the alternative, or whether the shift is going to cover our learners in schools.
Thank you. Who is the member there? Is that Edith Nyenze? Yes, Edith?
Thank you, Speaker. I wanted to find out from the CS, how do you compare the rate of death from the time the doctors went on strike as compared to the last time last year? And as your ministry, is your ministry doing enough to ensure that the doctors go back to work?
Okay, yes, Women Rep for Narok, Rebecca Tonkei. Yes, there you are.
Yeah, thank you, Mr. Speaker, sir. I want to ask the CS, Honorable Speaker, the CS has spoken about the internship policy which they are developing. And Mr. Speaker, sir, I've had an opportunity to skim through that policy. And what I realized, the CS proposal will further discriminate the interns. Because when you look at one of the proposals, is that CS, you've said that there are those who will not qualify for the stipend. And among them are people who are self-sponsored. So it means if a student is sponsored by the parents or corporate bodies, then that student will not qualify for that stipend. Honorable Speaker, can the CS tell us what is the reason? Because this is going to further discriminate the students who are self-sponsored. Secondly, Mr.
Only one, Rebecca.
Okay, thank you.
Only one. Elachi will be the last on this, then we go to other questions.
Thank you, Mr. Speaker. And while I appreciate Waziri for very elaborating us to understand and also making us understand the figures. You know, when you get the figures, Mr. Speaker, is when you realize the interns are quite a good number. And we just have to think, even in this House, how to add some budgets. But having said that, Mr. Speaker, my question is, the missionary doctors are being asked to pay Kenya shillings 500 per year for their work permit. And I would wish Waziri to look at it, because right now when the doctors were in strike, I believe the missionary doctors who come in as volunteers are the ones who have been working, and most of them come for churches and all that. So if she can look at it, I know she might not be able to answer completely here, but it is something we need to look at it as a country. I don't know whether it is right to charge 500,000 to that.
Minister.
Thank you, Honorable Speaker and Honorable Members. The question raised by Honorable Kibagendi regarding payment of NHIF claims. Indeed, there has been a delay in payment of claims due to delay in exchequer release. Honorable Speaker and Honorable Members, as we speak now, NHIF owes service providers close to 30 billion shillings. And of these 30 billion shillings, 22 billion is owed to NHIF by government and other government entities. Honorable Speaker and Honorable Members, this week, we have had a meeting with National Treasury, and yesterday, the Principal Secretary for Medical Services did receive a confirmation from Treasury of a release of 5.5 billion for payment of claims. So we are expecting that once the money hits the account this week, then payment of the claims by NHIF need to proceed as from next week. But also want to clarify that payment of claims is an ongoing exercise. Last year alone, NHIF paid out a total of 36 billion shillings. So as claims continue to be verified and reconciled, they get to be paid as and when exchequer releases are available. The issue by Dr. Nyikal about the CBA, really a CBA is collective bargaining agreement between an employer and an employee. Medical cover is provided by the employer to an employee. So I still want to say, Honorable Speaker and members, that as national government, we can only take responsibilities for the employees that belong to the national government. And having said that, the issue of a CBA is not a policy issue. The issue of a CBA is what is signed and agreed between parties. But the ministry, we continue to play our responsibility in development of policies, and that is why at the moment we are working on the internship policy. Regarding Edu Afia, Honorable Speaker and Honorable Members, this scheme came to an end, lapsed in December. Before lapsing, the Ministry of Health wrote to the Ministry of Education, informing them of the end of the scheme of Edu Afia. We expected that then the Ministry of Education would write back and ask the Ministry of Health to extend that, but that was not done. So we did not receive an extension. However, Honorable Speaker and Honorable Members, I would like to confirm that under the new Social Health Authority, we now have a cover for all Kenyans. And this has expanded benefits package that besides Edu Afia that was covering a student, the Social Health Authority Act now ensures that there is a cover for all members of the family. That includes mama, it includes the children who are in school, it includes the mzee who may not be at school. So we now have an expanded benefits package to cover all members of the family. Honorable Speaker and honorable members, the issue of the rate of death in the facilities occasioned by this crisis. Honorable Speaker and honorable members, the ministry has a tool on a daily basis that we get to receive what is happening in our health facilities. And from the national level, honorable Speaker and honorable members, the rate of death has gone down. But as a ministry, we know it is because people have not been coming to hospital. So we want to go further and drill and see what is happening within the communities. And once we get to that point, then we shall conclusively say what is the rate of death based on the crisis. The question raised by Honorable Tongei regarding the policy that there is a discrimination. I would like to affirm that the policy is still under development. We have only done internal stakeholder validation. We have an opportunity for external stakeholder validation. And during such a process, comments, reviews, and suggestions are received from several stakeholders. And I want to believe that if that came through from their stakeholders, then it will be subjected to the process. And the document that we will end up with as the policy will be one that speaks to the needs of majority of Kenyans. On the issue of missionary doctors, the permits, Honorable Speaker and honorable members, are issued by Ministry of Interior. I would not want to comment on it. For us, we wait until they have been issued permits, then the Kenya Medical Practitioner and Dentists Council issues licenses for their practice. But that is an issue that has been raised by the faith-based organizations, and it has already been given to the attention of the Ministry of Interior to be able to look at it and see how do they rationalize. And I want to agree with the honorable member that indeed the missionary hospitals, the faith-based facilities are playing a critical role during this crisis. Thank you, Honorable Speaker and members.
Thank you, Minister. We'll end there on this question. We'll now go to the next questions. Honorable members, the next ones, I'll allow the questioner and one joyrider so that we can make progress. Member for Ruiru, Simon Kingara, question 020 of 2024.
Thank you, Honorable Speaker. May I take this opportunity to thank you for granting me an opportunity to ask a question number 20 of 2024, directed to the Cabinet Secretary for Health. Could the Cabinet Secretary clarify whether the Kenyatta University could the Cabinet Secretary clarify whether the Kenyatta University Teaching, Referral and Research Hospital imposes high deposit before attending to patients and that the NHIF cover caters for very minimal amount as compared to other facilities such as Kenyatta National Hospital and Kiambu Level 5. Number two, Mr. Speaker, sir, could the Cabinet Secretary provide details on the budgetary allocation provided to the hospital in the financial year 2023-2024, and further confirm that the Credit Control Department holds numerous title deeds for patients who are unable to meet the high medical bills and considerable number of bodies are locked at the hospital mortuary. Finally, Mr. Speaker, could the Cabinet Secretary elaborate on measures by the ministry to ensure affordability, including offering the waivers of health care services within the facility, especially given the diverse income levels of the population of rural and neighboring constituencies that the facility serves? Thank you, Mr. Speaker.
Thank you, Honorable Speaker and honorable members. We need to clarify whether Kenyatta University Teaching and Referral Hospital imposes high deposits before attending to patients, and that the NHIF cover caters for very minimal amounts as compared to other facilities such as Kenyatta National and Kiambu Level 5 Hospital. Honorable Speaker and honorable members, Kenyatta University Teaching Referral Hospital does not impose high deposits before attending to patients. The hospital attends to all patients who come through either referral, through the specialized clinics, or through the outpatient department or the accident and emergency department. These patients who come to this hospital, they are in most cases seeking highly specialized care since it is a referral hospital. At the accident and emergency department, patients are normally stabilized even before they are asked to pay the consultancy fee. At the outpatient department and the specialized clinics, patients pay a minimal consultancy fee as prescribed by the consultants. Deposits are only asked for where the consultant determines that the patient needs admission for continuation of care as explained hereafter. The hospital admits patients through the referral, specialized clinic, or an emergency basis. The hospital admission policy and procedures and the hospital referral policy are both informed and aligned to Article 43, Part 2 of the Constitution, which states that no person shall be denied emergency medical treatment. The admission policy and procedure section states that the hospital will ensure that no patient shall be denied admission due to race, color, religion, ancestry, financial class, nationality, or any other form of discrimination. In the same policy, in cases of emergency, there will be no financial obligation. The referral policy states that all emergency referrals to be accepted without fail and unnecessary delay or shunting of patients should be avoided. They will be given priority on arrival. Honorable Speaker and honorable members, on waived hospital bills, the hospital does not deny care to any patient who requires emergency care or admission on the basis of cost of care. Majority of these patients get admitted without the deposit, but with a promise to pay upon discharge. However, some do not honor their promise because they are genuinely unable to cater for their treatment costs fully. Others are only able to pay partially for the services rendered. As a result, the hospital has unpaid bills of 403 million since the hospital began 4 years ago. And this now has been requested in the budget for reimbursement. Regarding the NHIF cover, the hospital has a hybrid model that has both comprehensive and non-comprehensive covers. Patients admitted under the comprehensive cover do not top up for the cost of their care, including all required pharmaceuticals, diagnostic services, surgery, and medication. For example, for all patients under the national NHIF scheme, access surgery purely under the comprehensive cover. Under NHIF non-comprehensive cover, patients co-pay as outlined in the contract for different services. This arrangement is actually the same with that of Kenyatta National Hospitals. Patients at Kenyatta University Teaching and Referral Hospital have access to a whole continuum of care with a rare need to access services like imaging, special lab works, specialized consultancy outside the hospital. This is unlike the lower level hospitals where patients have to buy some items or seek services outside the facility, which translates to huge out-of-pocket costs despite the NHIF cover. On part 2 of the question, that we provide details on the budgetary allocation provided to the hospital in the financial year 2023-2024, and further confirm that the Credit Control Department holds numerous titles for title deeds for patients who are unable to meet the high medical bills, and considerable number of bodies are locked at the hospital mortuary. Honorable Speaker and honorable members, the hospital budgetary allocation for financial year 2023-2024 was 5.8 billion shillings, consisting of the GOK grant of 2.986 billion and the A&A of 2.9 billion. The development budget for the hospital is 350 million. The actual expenditure for PE is 3.988 billion against the GOKP allocation of 2.986 billion. Hence, there is already a gap of 1 billion, which the hospital struggles to meet despite it not having the required staff establishment for optimal service delivery. In the next financial year, 2024-2025, the hospital requires a PE allocation of 4.072 billion from the government. In the Department of Credit Control, the hospital's Credit Control Office plays a crucial role in assisting families facing financial difficulties by offering credit payment plans. This initiative benefits both the patients and the hospital in several ways. The benefit to the patient is that elimination of unnecessary hospital stay. Patients can leave the hospital once arrangement for payment has been made, and this reduces their stay. Prevention of accumulating unmanageable bills. By entering into credit payment plans, patients can manage their medical expenses over time rather than facing a large immediate financial pain. Reduced risk of hospital-acquired infections. Due to the shorter hospital stay, they decrease the likelihood of patients contracting infections during the time in their hospital. The benefit of these payment plans to the hospital is that there is availability of hospital space. Releasing patients who have settled their payment arrangement it frees up space, allowing the hospital to accommodate other patients. Efficient resource allocation. By recovering debts through credit payment plans, the hospital can allocate its resources more effectively, ensuring that resources are available for patients who need them. There is also mitigation of budgetary limitations, thus managing outstanding debts and helps the hospital to navigate the budgetary constraints that it experiences. The use of title deeds as security for these arrangements. Title deeds are utilized solely as security for the commitments made by the patients or their families. Once the debt are fully recovered according to the agreed upon terms, the title deeds are returned to their respective owners. This practice provides assurance to the hospital that the debts will be repaid, while also safeguards the assets of the patients or their families. Overall, this approach demonstrates a proactive effort by the hospital to address financial challenges faced by patients and their families, while also ensuring efficient operation of healthcare services within the constraints of budgetary limitation. The issue of dead bodies being locked at the hospital mortuary, the hospital preserves dead bodies for relatives as they make funeral arrangements. Some bodies stay longer in the morgue for long due to various factors. Some have cases arising from courts and there are disputes, therefore the bodies stay longer until the dispute is resolved. The hospital also has unclaimed bodies. We have delays from families as they fundraise and make funeral arrangements. Some families make requests to be allowed time to enable them to fundraise, since once a burial is done, it becomes difficult for them to mobilize funds. Where a family has requested for a waiver of a hospital bill, they wait for the outcome of the waiver process. The process involves socioeconomic analysis, and at times, it involves a home visit to enable an objective determination of the request. Part 3 of the question, to elaborate on measures by the ministry to ensure affordability, offering of waivers for healthcare services within the facility, especially given to the diverse income levels of the population in Ruiru and neighboring constituencies that the facility serves. Honorable Speaker and honorable members, the Ministry of Health is currently on course in the establishment of the Social Health Authority and the seamless transition from NHIF. The Social Health Authority will provide social health insurance up to 85% of the population in the formal and informal sector. The government will continue paying for the indigents and the vulnerable populations. These measures will ensure that most Kenyans, including the poor and the vulnerable households, will have a form of prepayment of health insurance anytime they visit a facility, and they will not have to pay from out of pocket. The Social Health Authority, together with the Ministry of Health, has developed a comprehensive health benefits package enough to cover at least 70% of the prevalent conditions. The citizens of Ruiru and Kenyans at large will have to register and contribute to the social health insurance depending on their ability to pay in order to access services, not just at Kenyatta University Teaching and Referral Hospitals, but within other facilities. The Ministry of Health has also come up with a clear communication strategy on universal health coverage that will sensitize citizens on the need to enroll in social health insurance and therefore be able to benefit on the expected benefits from the Social Health Authority. Honorable Speaker and honorable members, I hereby submit. Thank you.
Member for Ruiru, you're satisfied? Give him the mic. There you are.
Thank you, Mr. Speaker, sir. The questions are necessitated by discomfort of the community, and as it was answered to us. There are some areas which maybe I need some clarification, if you allow. Mr. Speaker.
Just seek one clarification.
Yeah, actually it's one clarification.
Yes.
Mr. Speaker, at the last bit of the answering, the minister said that the bodies or the documents are held because of arrangement by families or the same. But Mr. Speaker, there are documents held by that facility, and I have evidence for more than 2 years. So my question is, how long can the facility hold the documents for the concerned family or the deceased person? And secondly, maybe how long also can they hold the body, because we also know bodies which have been there for many, many months or years. Thank you.
Waziri? Sorry. Makali Mulu? Yeah,
Thank you, Honorable Speaker. Honorable Speaker, it looks like I misplaced my card, so I want to thank you for giving me the chance. Honorable Speaker, I want to ask a question which is related to the issue. Although this question is specific to Kenyatta University Referral Hospital, I think the bigger issue, Honorable Speaker, is the issue of the cost of treatment in this country, both medication, consultation, and all things to do with surgery. And Honorable Speaker,
Makali Mulu, I've given you an opportunity to ask a supplementary to the specific question
yeah. My specific question, Honorable Speaker, now that we have the CS here, is there anything the ministry is doing, Honorable Speaker, to bring down the cost of medication in this country and treatment? Because I think that's a bigger question, Honorable Speaker, in this country.
Okay. Minister, answer the two. Esther, you have two questions, so just hold your horses. You can combine whatever you want to ask within your questions.
Thank you, Honorable Speaker and honorable members. On the issue of how long the bodies should be kept and should the documents be kept, Honorable Speaker, as I submitted earlier, before this is done, there is normally a conversation between the family and the hospital, and they agree on a plan. So once the plan is finalized, then the bodies are released or the documents are released to the family. But we shall retreat as a ministry to check into the ones you have said that they have stayed for very long. We are happy to get the specifics so that then we can address it with the hospital. Honorable Speaker, on the cost of treatment, the ministry has shifted focus from focusing on curative nature to now primary health care. Primary health care, Honorable Speaker and honorable members, is to ensure that we focus on prevention of disease. In itself is a way of ensuring that we manage the cost of health care. But furthermore, in terms of the commodities and other health products and technologies, the ministry has reinvented and is working specifically to focus on local manufacturers to ensure that other costs that are lumped on products and technologies, being that they have been brought into the countries, are reduced. And so far, the Kenya Medical Supplies Agency Authority has been able to implement the local manufacturing policy, and close to 50% of the items are now being sourced locally. Chair and honorable members, I submit.
Joshua Kandia.
Thank you, Honorable Speaker. I rise to ask question number 021 of 2024, and this is directed to the Cabinet Secretary for Health. 1. Could the Cabinet Secretary provide a list of all community health promoters in all the 290 constituencies? 2. Could the Cabinet Secretary explain the methods used by the ministry to select the said community health promoters across the country? 3. Could the Cabinet Secretary explain why drivers are not considered and counted as prone to risk while handling the emergency cases in Kenya? Thank you, Honorable Speaker.
Minister.
Thank you, Honorable Speaker and Honorable Members. The question is for the Ministry of Health to provide a list of all community health promoters in the 290 constituencies. Honorable Speaker and Honorable Members, I would like first to begin by saying community health services aim at empowering individuals, families, and communities to take charge of their health. Community health services are delivered by the community health promoters at the household level. And some of the services that they provide is health education and promotion, disease prevention and control, and this is to reduce morbidity, disability, and mortality, family health services, environmental health, provide first aid, psychosocial support, and managing the general health data. Honorable Speaker and Honorable Members, community health promoters are assigned approximately 100 households which they visit on a routine basis. Each community health unit has 10 community health promoters. There is a community health committee that oversees the affairs of a community health unit. Each community health unit comprises of 5 to 7 members drawn from among the community members. We have a table, Honorable Speaker and Honorable Members, that has enumerated the community health promoters per county, but we have these names per constituency. Across the nation, we have 107,000 community health promoters. If we were to print, that would be very bulky, but we are able to offer the soft copy specifically for Baringo County, Baringo constituency, and any other constituency that may want to see the list of the community health promoters. On the second question.
For the curiosity of the member, I don't know what he wants to know, but he just sent the soft copy of all the 290 constituencies. He'll go through. If he has any issues, he can file a question through the committee.
Okay. Thank you,
go to the second question.
On the second question, explain the method used by the ministry to select the said community health promoters across the country. Honorable Speaker and Honorable Members, the selection of community health promoter is guided by Section 9 of the Primary Health Care Act 2023, which defines the criteria for community health promoter as follows. A community health promoter shall be selected by the community through a public participation forum, and they shall be appointed by the county government. A person qualifies for selection and appointment as a community health promoter under subsection 1 if the person is a citizen of Kenya, is above the age of 18 and is of sound mind, is responsible and respected member of the community, understands the role of community health promoter, is a resident of the respective community for a continuous period of not less than 5 years prior to the appointment date, is literate and can read and write in at least one of the national languages and the local language, is not disqualified for appointment office by any other criteria of law. A community health promoter shall be appointed on such terms and conditions as the respective county public service board shall determine. Each county executive committee member shall prescribe in the county legislation regulations approved by the respective county assembly for the conduct of public participation forum. Section 10 further provides for a framework for the conduct of the public participation during the selection of CHPs. Conduct of public participation. In conducting the public participation forum under Section 9, the county executive committee member shall publish and publicize through the mechanisms established by a county government under Section 95 of the County Governments Act a notice of the proposed selection process at least 7 days before the conduct of the process. They are expected to avail to the residents of the county information regarding the agenda with respect to the selection process, criteria for selection of community health promoter, the process of submitting the nomination for selection, and such other information as the committee member may consider necessary for the effective participation and conduct of the selection process. The public participation shall provide, where necessary, interpretation of services for persons who are not conversant with the national language, where the national language is the principal language of communication during the conduct of the public participation forum. They shall keep and maintain an attendance register for all persons attending the forum. The conduct of public participation forum shall be guided by the principles of citizen participation in counties under Section 87 of the County Governments Act, provision of effective mechanisms for involvement in the public including special interest groups who will be affected or be interested in the decision. Participants' equitable access to the information they need to participate in a meaningful manner. Establish of an appropriate feedback mechanism, adherence to the national values under Article 10 of the Constitution, adherence to the principles of public participation as may be prescribed by the written law, and ensuring that the needs and interests of all persons are catered for. The transition of existing community health volunteers, health workers to community health promoters. Despite Section 9, a person appointed as a community health volunteer or community health worker at the commencement of the Act shall be deemed to be appointed as a community health promoter under the Act. The third question is to explain why drivers are not considered and accounted as prone to risk while handling emergency cases. Honorable Speaker and honorable members, delivery of universal health coverage, including quality emergency care to all Kenyans, is a priority for the government of Kenya and the Ministry of Health. Emergency vehicle operators or ambulance drivers play a key role in the delivery of quality emergency care. The Ministry of Health recognizes them and that they are exposed to diverse risks as they perform their duties. The Ministry of Health is committed to ensuring the safety and well-being of all healthcare personnel working in Kenya. The Constitution of Kenya 2010 states that every Kenyan has the right to the highest attainable standard of health, which includes the right to healthcare services. The Health Act 2017 states that every person has the right to emergency medical treatment, including pre-hospital care. The Social Health Insurance Act of 2023 establishes the Emergency, Chronic and Critical Illness Fund to cover the cost of emergency treatment. The Ministry of Health has developed the Kenya Emergency Care Policy 2020-2030 and Kenya Emergency Care Strategy 2020-2025 to accelerate the development of an effective emergency medical care system for Kenya. The policy and strategy are based on World Health Organization Emergency Care System Framework, which highlights 3 areas where emergency care is provided: at the scene of illness or injury, by bystanders, deliver first aid and call for help from the ambulance service. Further care may be delivered by emergency care personnel when they arrive at the scene. During transport in an ambulance, the patient is monitored, information regarding the patient is communicated to the receiving health facility, and delivery of medical intervention continues. At the health facility, the patient is received by emergency department staff for ongoing care. The Kenya Emergency Care Policy 2020-2030 recognizes the key role played by emergency care personnel, including the drivers. It highlights the shortage of these key personnel in Kenya. The Kenya Emergency Care Strategy outlines the key intervention to increase the numbers of drivers to ensure that they have the knowledge, skills required to deliver quality service to Kenyans while minimizing the risk to themselves, to the patients, and to other personnel and other road users. And the key interventions are development of a standardized curriculum for training of these drivers, establishment of a standardized framework for regulation, licensing, and continuous professional development of emergency ambulance drivers, institution of norms and standards for staffing all levels of emergency care. The ministry intends to roll out a holistic program to enhance capacity to motorcycle riders, institution drivers, matatu and lorry drivers on basic first aid and triage, which we have called Afya Barabarani. Training and equipping community health promoters on first aid and joint emergency interoperability principles that is linking services together. The ministry plans to establish a command and control center linked to ambulance dispatch centers, fire department, police, and all emergency support function. A toll-free number to be provided to all sectors for emergency calls, immediate triage, sorting, and timely response. In 2019, the Kenya Bureau of Standards, in collaboration with the Ministry of Health, developed a minimum ground ambulance requirements. Compliance with these detailed requirements promotes safety for the ambulance drivers and all passengers traveling in an ambulance. In conclusion, the Ministry of Health is committed to delivering quality health services to all Kenyans. This includes the safety and well-being of healthcare personnel, including the ambulance drivers. While a lot remains to be done, and the ministry is committed to delivery of quality training registration, licensing, and continuous professional development is ongoing for the existing numbers. Honorable Speaker and honorable members, I submit. Thank you.
Thank you. Kandia, are you satisfied? Give the mic to Honorable Kandia.
Thank you, Honorable Speaker. I am partly satisfied. However, the last question, the CS has not given us whether they are going to be considered as, they are going to be given a risky allowance, drivers, because they are doing the same work the other emergency workers are doing. That is that was
drivers
my question.
In the ministry or drivers anywhere?
Emergency drivers.
Or emergency drivers?
Yeah.
Okay.
And secondly, Mr. Speaker, I have a second question which the minister can answer. Can the cabinet secretary tell Kenyans whether county government is paying these community health promoters, or they are relying on national government only?
Minister, take a minute to answer that. We now must move faster.
Thank you, Honorable Speaker and members. On the issue of risk allowance to drivers, I think that needs to be determined by the Salary and Remuneration Commission, and as a ministry, we will write to get their guidance. On the issue of payment to community health promoters, the national government and the county government have signed an intergovernment participating agreement whereby 50% of the stipend is paid by the national government and 50% of the stipend is paid by the county governments. I want to confirm that the national government is paying the stipends to the community health promoters. Thank you, Honorable Speaker and members.
Duncan Madenge. Minister, now we must take a maximum of 5 minutes per question.
Thank you, Honorable Speaker. I wish to ask question number 086 of 2024 to the Cabinet Secretary. Could the Cabinet Secretary explain the factors used to determine how much a non-salaried Kenyan citizen ought to pay to SHIF and how regularly they should pay per year? Second question, the second part of the question, could the Cabinet Secretary state the percentage of the salary that employed Kenyans should be deducted from the payslip towards the SHIF, and further clarify if there is an upper limit on the contributions? Thank you, Honorable Speaker.
Minister.
Thank you very much, Honorable Speaker and honorable members. The question is for us to explain the factors used to determine how much an unsalaried Kenyan citizen ought to pay to Social Health Insurance Fund and how regularly they should pay per year. Honorable Speaker and honorable members, I want to begin by appreciating Honorable Duncan Madenge as a member of the Health Committee. We have been with him in discussions. He has been participating actively in the development of regulations, and he even hosted the Ministry of Health during the public participation of regulations in Nyeri. Section 27 of the Social Health Insurance Act 2023 provides that in case of a household whose income is not derived from salaried employment, an annual contribution of a proportion of household income is determined by the means testing instrument. In the Social Health Insurance General Regulations 2024, this was further explained by Regulation 18, Part 1 to 2, which states that a household whose income is not derived from salaried employment shall pay an annual contribution to the Social Health Insurance Fund at a rate of 2.75% of household income as determined by the means testing instrument as per Regulation 21. The factors to be considered by the means testing tool are individual and household characteristics. Individual characteristics include the number of family members, marital status,